Garland and Garrett, fraternal twins and aspiring music producers who love to shoot hoops. Katie, a softball player, jogger, and outstanding member of the school debate team. And Summer, a dancer and public speaker who loves to show livestock. Each of these teenagers has scoliosis, and each has a story to tell. They're just a few of the thousands of teens who come through the doors at Texas Scottish Rite Hospital for Children with dreams of living their lives like everyone else.
I was scared, I was surprised. Am I going to stay in the hospital? You know, how long is it going to be until I go back to school? How much work am I going to miss, you know?
My back is essentially an S curve. Before my surgery, it was 50 degrees on the top and 60 degrees on the bottom. So I had two separate curves.
I feel really good. I'm a lot taller and I can breathe a lot easier, and it's just been so much better than it was, and I'm so excited.
Scoliosis is a curvature of the spine that is more than 10 degrees, causing the spine to twist into a C or S shape. The curve grows as the child grows, and if left untreated, scoliosis may progress, causing breathing issues and back pain. There are several types of scoliosis, but the most common is adolescent idiopathic scoliosis.
I have kids who come to see me that were born with scoliosis, and they were born with scoliosis because their spines were never formed normally.
Congenital scoliosis, and this is a scoliosis that is caused by a failure of normal formation of the vertebral column in the fetus. So in fact, the scoliosis is present at birth, and an X-ray will show the abnormality immediately.
The second type of scoliosis that I see is neuromuscular scoliosis. Those are curves that develop from children that have neurologic conditions. So my boys that have muscular dystrophy, some of the children that I see with cerebral palsy are going to tend to develop scoliosis or curvatures because their neuromuscular system is different.
The most common type of scoliosis we see is idiopathic scoliosis, meaning we don't know the cause, where all the vertebra or all the segments of the spine are normal and the patient is otherwise healthy and normal.
Adolescent idiopathic scoliosis may be discovered through a school screening or a doctor's exam.
Good. Okay.
However, Garland and Garrett's mother suspected her twin boys might have scoliosis when she noticed some physical differences watching them swim.
You could kind of see the curvature, especially when they were swimming. They were shirtless.
She's got all the right answers.
Next, it was a visit to their pediatrician and on to Texas Scottish Rite Hospital for Children.
What do you notice most about your back, Garland? Anything? Sometimes it hurts. When it hurts, where does it bother you?
The first tool that's used in assessing a child for scoliosis is just a visual examination. And we look at the child straight on while they're standing up nice and straight. We look at them from the side. We have them bend forward to touch their toes, called the forward bend test.
Just let your arms look straight down at your...
Scoliosis is not only a lateral curve, but there's most commonly a rotational aspect to the spine. And when the child bends forward, you can see a rib prominence.
So everything looks good. The x-rays, here's your x-rays. And here you are today.
Like many children, Katie's scoliosis was discovered through a mandatory school screening.
Yeah, when I was in 8th grade, they had a routine screening at my school, and I didn't think anything of it, but they sent a letter home saying that I had scoliosis and that I should go to my pediatrician.
So in the state of Texas, scoliosis screening is mandatory for all students, whether private or public schools, in the 5th and 8th grade. And school nurses are trained to carry out that screening process.
And school screening is effective in picking up curves. We use a tool called a scoliometer to measure the scoliosis just clinically as we bend the patient over to look at their back. And we look at the prominence of their ribs, for example, which is a very good tip-off for scoliosis.
Garland Smith.
When a child is referred to the hospital for treatment, X-rays are taken for verification. If the shape or location of a curve is unusual, even for scoliosis, the physician may also order an MRI.
If we see a new patient for the first time and by visual evaluation we don't see a curve that's estimated to be over 10 degrees, we may not do an X-ray at all. We certainly don't want to expose children to X-rays needlessly.
So, in kids who are very young or have certain other neurologic findings, an MRI scan is important as part of their evaluation because, remember I said that the most common form of scoliosis is idiopathic and we don't know the cause. Well, in some patients the MRI scan actually shows us the cause. So this is a safeguard as well as a diagnostic tool.
Once curve size is determined through physical examination and X-rays, as well as considering the child's age and future growth, the orthopedic surgeon suggests a course of treatment.
Treatment is primarily threefold. The criteria are curves that are less than 25 degrees, in which the children are growing. We generally keep a close eye on those type of curves, and we just observe, because the risk for progression, although can be fairly high, is not 100%. So between 25 and 45 degrees, we brace curves, and the goal of bracing is to prevent the curve from getting any bigger. The threshold magnitude where we consider surgery is above 45 to 50 degrees.
For Gail Smith, whose twins are 15, that meant bracing for Garrett and surgery for Garland.
Garrett was at about a 35. He was in the 30s with his curve. Garland was at a 50. And so, it's very evident looking at the film, the severity of Garland's curve. And so it was determined that Garrett could be treated with the back brace, wearing it from 18 months to 2 years to straighten him up a little bit and then prevent it from getting worse. And then for Garland, it was determined that the surgery would be the best method of treatment.
Bracing is a very effective tool in scoliosis, and we are very fortunate to have within the institution a world-class orthotics department. And each brace that each child gets here at Scottish Rite Hospital is custom made for each child.
The orthopedic surgeon works with an orthotist in prescribing a brace to provide the most effective treatment for the patient.
As an orthotist, our role is primarily to provide braces for the children, and so that involves a whole process. We start by seeing the patient, and then we measure or take a cast of the patient, and then we design a brace, and then we'll see the patient back a few weeks later and fit that to the patient. So we're involved with the design and fabrication of each orthosis that we give to each child.
Always striving to improve treatment outcomes for patients, the hospital has added CAD/CAM to their ability to manufacture custom-molded braces.
This is a mold of a patient with scoliosis who we have modified their brace, or what's going to be their brace, on the computer screen. And the nice thing and the beauty about this system is we interlay x-rays of the patient as well as pictures of them into the brace shape so that we can get a truer picture of what the patient is going to look like in the brace and how the brace may affect their curvature. Once we get the shape into the system, we then do all of our modifications on the actual shape in the computer. Instead of having to take a plaster cast of a patient where we're getting pretty messy with this plaster casting material, this enables us to take a optical laser scan of their body, and it captures the image of their body shape and then transfers it from the scanner into the computer system where we would then modify that shape. Once we're done doing that, we're able to then send it to the carving machine where it actually carves out the mold of the patient that the brace will then be made over. And this is much better and much lighter than the previous plaster molds that we used before. This foam block that we use now to make the mold weighs approximately 1 to 2 pounds. So it is much lighter, so it's actually going to be safer. This is something that we will be seeing a lot more of in the future, and the carver itself is able able to carve very small images or models, which was another advantage for us when looking at the various systems out there, that this system was really something to be used with pediatric population.
After we've designed the brace and had it made to that child, it comes back to us as a practitioner close to being done, but it's not ready for the child. There's a lot of custom fine-tuning that needs to still be done, and that's where we come back into play with the fitting appointment. Those appointments can be quite long sometimes, even up to 3 hours, but that's because we do a lot of trimming, adjusting, heat flaring to make sure that, for one, it's comfortable for the child, and two, that it fits appropriately for what we want to be treating.
There are two main types of braces: the all-day nighttime brace, which is worn between 18 and 23 hours, and the nighttime only brace, worn just at night.
Good days I wear for 20 hours, but on some days I take it off like around 18 or 19 hours.
When his time was up, he would take it off, and it wouldn't be at home. It might be on the bus stop. He rides the Dart back and forth to school, so he didn't have any problems taking it off and carrying it in his hand in downtown Dallas. He said it was really nice because the girls had sympathy on him.
At school, sometimes I take it off, and the girls start to come, "What's wrong?" And I got scoliosis, and I just love it.
His biggest issue is when he wants to play basketball. And so he wants to come out of the brace so he can do all of his moves.
Knowing it's not always easy to wear a brace, the team at Texas Scottish Rite Hospital for Children tries to help children with what works best for them. For example, kids are encouraged to remove their brace for short periods of time so they may still participate in sports and physical activities. They also learn to make adjustments in their clothes because of the added thickness around their waist and midsection. Teenagers often need to wear one size bigger in pants and loose-fitting tops to cover the brace.
I got fitted for a brace as well. I started wearing my brace between the summer of the 8th grade and 9th grade. And luckily, fashion allowed for me to hide it very well. And in fact, Scottish Rite also helped. That summer, before starting my 9th grade year, Scottish Rite had a fashion show for all the students with back braces. There had to be about 25 of us with all of the clothes at that time that we could wear with our braces. So that was really comfortable, and it was also good to see some other young ladies going through the same thing.
I think a lot of the time families face the issues when a child, the parents are real gung-ho with wanting their child to wear the brace, and they don't have full control of that child in wearing the brace. When the child leaves home to go to school, the child is really the one that has to be responsible for understanding why we're having to use the brace, so that they buy into the program and make sure that they're going to want to continue to use it during the times when mom and dad aren't always looking after them.
Knowing that compliance is a big issue with teenagers, Texas Scottish Rite Hospital for Children conducted groundbreaking research that supports bracing as an effective treatment of scoliosis in stopping curve progression and, secondarily, in avoiding surgery.
One of the key findings is that if a child consistently wears their brace, aiming for at least 16 hours per day throughout treatment, then there's more than an 80% chance their curve will not worsen. And in fact, all those that fell into that category, none of them required surgery. But the most common denominator for those that wore the brace well and prevented, and therefore were successful in not having any kind of curve progression, let alone avoided surgery, are those patients that wore the brace to school. And that is one of the more challenging things to do. We're well aware of that, and that's why we're always dedicated to try to come up with the best design possible to make the brace as concealed as possible, knowing that they need to wear the brace to school in most cases for it to be truly effective.
As Garrett wears his brace, his brother Garland prepares for surgery.
Knock, knock. Hey guys, how we doing?
Doing great.
How are you? Garland, how you doing? How's your brother?
Good.
Is he behaving himself? Yeah. Is he? Good. How are things? Ready for tomorrow? Yeah? Big day, you a little nervous?
A little bit.
Yeah, that's normal. Come on up, let's take a quick peek at your back. We actually need to get...
Garland's upcoming surgery will be the first time the brothers have been separated for any length of time. Besides being apart from his brother, Garland admits he was apprehensive when he first learned about the surgery.
Just a bunch of stuff going through my mind. I had mixed emotions about the whole thing.
Texas Scottish Rite Hospital for Children utilizes a family-centered, multidisciplinary approach in treating patients. This includes a commitment to educating patients and their families in understanding the need for treatment and what it entails.
I think 3 or 4 doctors, they came into a room and they explained what was going to happen. They explained why I had to get surgery. And they answered my questions. And yeah, they did a very good job of explaining to me, you know, when, what, why, and how.
Pain and fear are very closely related. So when you talk to patients about surgery, if you can prepare them enough so that they really see and understand what's going to happen, they recover much, much more quickly.
12, 1, 2, so 12 segments.
They made us very comfortable by telling us all the procedures, telling us how everything would go, and then also giving it to us in writing so we could share with family and friends.
On the day before surgery, Garland checks in and meets the team that will take care of him during his hospital stay. Once Garland has checked in at the front desk, he follows the signs to Zippity Zebra and receives his schedule for the day. It's off to X-ray.
Well, congratulations, you wore the best clothes possible to have your X-ray study. Wait here and I'm going to go look for you.
X-rays are taken, which the surgeons will review with Garland and his mom during clinic. Once the X-rays are completed, it's off for more instructions and paperwork.
And we're going to see everybody that's involved with your hospital stay. We'll see you today and answer any questions.
Garland makes a stop for his medical photo, and then it's time for blood work, his biggest fear.
This way.
Thank you. You made it.
Once it was all over, he texted his brother saying it was easier than he thought it would be. Following his lab work, Garland goes to clinic to review his X-rays with Dr. Sakato and learns that his curve has grown a few degrees since his last appointment, further supporting the decision to have surgery.
See on Garland, when he bends forward, you don't see as much of the translation, but what you see is the rotation. So when he bends forward, instead of his spine being nice and straight like this, he's got this, but what you're really seeing is the rotation. And that's part of scoliosis. I mean, that's defined scoliosis. The curve today, we're measuring at 57 degrees. Before, it measured a few degrees less than that. That's not a big deal. It doesn't change anything we do in terms of surgery or what his outcome is going to be with surgery. And the goals of surgery tomorrow are twofold. One is to correct the curve a certain amount. And the second goal is to prevent the curve from getting any bigger. And that's the real important goal. And the way we do that is we attach to the spine some metal implants, which are then used to correct the spine, and they'll hold the spine in that corrected position until the spine fuses or knits together. You're going to do great, okay? All right. Good to see you again.
After hearing what happens before, during, and after surgery, Garland and his mom head to the hospital pharmacy to review medications. Next, it's off to learn about pain management, see his hospital room, and meet the rest of the healthcare team that will be taking care of Garland while he's in the hospital.
Ever heard of Child Life before? No? Okay, well, part of our job is to help kids cope with being in the hospital.
As Aaron explains to Garland how an IV will deliver pain medication, his mother meets with the dietitian, nurse, and anesthesiologist. His brother Garrett joins him in his room for the last time before surgery. Garland's mom will stay the night at the hospital, and they'll be up early to get going in the morning.
We're all set to go. Went over all his X-rays again, reviewed the plan.
They said once I get surgery, I would have a full recovery and I can go back to the things that I do. I stayed calm. I didn't make a big fuss. I didn't get mad or nothing. I just stayed calm.
There are primarily two types of spine surgery for scoliosis. Anterior spinal fusion, where the approach is through the chest, and posterior spinal fusion, where the approach is through the back. Surgery may take anywhere from 3 to 7 hours or longer, depending on the size of the patient and the size of the curve.
The most common kind of surgery we do is posterior spinal fusion. We attach a number of screws or hooks to the spine and attach metal rods to those screws and then manipulate the spine around and improve the curvature. That's by far the most common.
Katie, how are you?
Good,
How are things?
Okay, well, they took my S-curve and they had 2 rods. And by using 19 screws, they screwed the rods into my back and they straightened it up.
3 good motion segments.
My vertebrae are fused in the middle of my back, so that way I can still have flexibility and motion.
Looks really good. So we stopped at this L3 level, and you know, you've got this spondylolisthesis at this L5, S1 level. So this is a good level to stop. It leaves you with 3 good motion segments below where your fusion was. And just as important as this x-ray is the x-ray looking from the side. So when we look at it from the side, you got nice thoracic kyphosis, you have nice lumbar lordosis. That grade 1 spondylolisthesis between L5 and S1 looks exactly the same. So it's good news. Yeah. So any questions?
To expedite recovery, pain management is extremely important as patients go from the operating room to hospital stay to home.
Well, immediately after posterior and anterior spinal fusion surgery, the patient usually has an epidural catheter in the lower back to deliver pain medicine directly to the spinal area. And that's usually for the first 24 hours after surgery. After the patient's GI tract is awake and working well, then they go on oral pain medication. It's usually a hydrocodone product if the patient's not allergic to that. And they're normally on pain medicine by mouth for about 2 weeks, and then they slowly wean to Tylenol or Motrin.
And then typically we're pretty aggressive about getting children up after surgery so that they can start to sit into a chair on the first day after surgery. They're walking on the second day after surgery. And then usually the most common day to head home after surgery is the 4th or potentially the 5th post-operative day.
Once they leave the hospital, you know, it's kind of what to expect. And I think one of the things that we know through kind of personal experience is the first night at home is always the worst. And the second thing to know is the #1 reason why patients and their parents call the nurse after they've been discharged from the hospital is for constipation, which obviously our adolescent, nobody really likes to talk about that very much, but it's really, really important. And so most patients are given some medicines to go home with to make sure that that doesn't become a problem. But that's really the first thing to think of when the patients aren't feeling well and they've lost their appetite.
And when they go home, there's no cast, there's no brace, and slowly after surgery, their activities are advanced, depending on the type of surgery that they had and the number of levels that were fused. And the activities that they want to return to.
Now I still play a little softball recreationally, but I jog and I enjoy running, and I'm also on the debate team. That's my real passion.
Katie is 16 and had her spinal fusion surgery 2 years ago. She knows how hard those first days were right after surgery, but also how much better she feels years later. So does 15-year-old Summer, who just had surgery 6 weeks ago.
The first week was probably the hardest, really the hardest, just with getting adjusted and all the pain. But I mean, after that, it gets better. And that's the good part, is that you know it gets better. So that's what really got me through it, is I just thought if I can get through this week, then I'll be okay.
Come on down, let's take a peek.
I would just say from parent to parent is, you know, use the support here that you have and make sure that you keep encouraging your child and pushing them, because that's what they need. A lot of times it's easier to sit in that chair and not get up because they're content and they're comfortable, but it's almost like bringing them out of their comfort zone in a different respect, because you've got to push them and make them be willing to do things.
Immediately after surgery, patients notice they are taller. Their posture is better.
I was 5'1", and then now I'm 5'3", almost 5'4".
So you are 5 foot 1, 2, 3 3/4 inch. Okay.
Almost 3 inches, so it's a big difference.
I just can't believe the difference in Summer. It is amazing. She's just come out of her shell. She's far more confident. She's always smiling. She has a smile on her face all the time.
What's the worst part?
Right now, I just am nervous to try stuff.
Yeah.
Just because I'm afraid I might just like tweak something or something.
Sure, yeah. What sort of activities do you like to do physically?
Basketball and dance.
Okay. Okay. Well, I'd reassure you, here are your x-rays. So there's your x-ray before surgery. Here's your x-ray today. So it looks very good. Got nice correction. So I'd reassure you that it's very difficult to do something that's going to cause any change in what your back x-rays look like in moving any implants. This is very stable. There's lots of anchor points, meaning the screws, the rods are strong. So the likelihood of you doing something is very, very small. And in fact, we're going to slowly ramp you up doing activities, and you're free to go swimming, you're free to ride a bike, do light jogging, shoot baskets. We want you to
Just as there are enormous benefits from surgery, there are risks as well.
What are the risks? Surgery is risky. There's little risk and then there's big risk. And
these are discussed openly with patients and their families as part of the decision process.
There's a small chance, about 1 to 2% chance of postoperative infection, and we combat that by, or hopefully prevent that totally, by giving IV antibiotics before and after surgery.
Well, the neurological risk of injury to the spinal cord or to the nerve roots that come off the spinal cord in idiopathic scoliosis surgery is luckily quite low. In fact, it's low enough that it's hard for us to give good estimates. Most estimates that have been published in the literature say that it's about 1 in 1,000 or 1 in 2,000 patients who will have a neurologic injury.
The surgery is really a team sport. And for whether it's the nurses or the anesthesiologists, we have neurophysiology technicians who monitor the spinal cord during surgery. So the patient, through little fine wires which they put all over their head and into their legs and limbs, and they're sending electrical signals and then monitoring how that comes through the spinal cord and watching these waves entirely during the surgery.
Okay. Temp is 36.3.
When you first learn your child needs spine surgery, it can be overwhelming. But the team at Texas Scottish Rite Hospital for Children is prepared to walk with you every step of the way.
It is very emotional to think that your child is going to have to undergo such serious surgery. It's huge surgery, and it's very frightening. And for families who are not familiar with the medical system, it's of course scary. Education, I think, is the key, and that's a big part of my job. It's one of the parts of the job that I enjoy. Oftentimes, I can put them in touch with another family whose child has been through this surgery. We call that peer support, and we do have a lot of very generous families who are willing to share with other families.
This is an example of a 19-month-old.
The hospital is a world leader in treatment, care, and support of patients and their families through top-tier scoliosis research.
Texas Scottish Rite Hospital for Children is very involved in the Scoliosis Research Society, which is an international society of surgeons throughout the world who are looking to advance the science and the treatment for scoliosis. At this institution, Carol Wise and her team were the first molecular genetics lab to identify a gene for adolescent idiopathic scoliosis.
Our first breakthrough was in 2007. We studied 53 families with idiopathic scoliosis, and that told us that a gene called CHD7 is associated with this disease. And it was a breakthrough because it was the first gene ever described, and it was also a breakthrough because it established proof of concept. It told us that we were using the right methods and that we could continue down this path to finding other important genes.
As research leads to more findings and improved treatments, it is known that scoliosis runs in families and is seen in the story of Garland, Garrett, and their mother. We also know that females are more susceptible to this progressive condition than males. But more importantly, we know these kids are just like everybody else. They want to participate in normal activities and have a normal childhood. And Texas Scottish Rite Hospital for Children is giving them that opportunity through compassionate care, advanced treatment, and innovative research. These teenagers, once self-conscious about their curved spine, now boast of building dreams, amazing stories, and living active lives.
I think the most important thing for the patients and the family to realize is that once we have identified the curve, whether it's a moderate curve and we're going to try to brace it, or whether it's a more severe curve and the patient is indicated for a surgical correction, is that this condition is treatable.
Be comfortable and know that you're in good hands, and if you have any questions or issues, don't hesitate to ask.
Everyone at Scottish Rite is wonderful. I've had the best experience ever here.
The experience has been well worth it. It's been wonderful. The support here at Texas Scottish Rite is amazing.
I feel more inspirational to other people, which I'm really happy about. Some people will see my scar and say, oh, you know what happened, and I'll tell them my story, and they're like, wow, you know, that's an amazing story. So I really feel more confident about myself also.